Okay, hello everybody. The presentation will be in the same vein than the previous one. Yes, I work in the cancer center and also at the University of Montpellier. Maybe you know that in France is the oldest faculty of medicine in Europe. So old, but I am a little bit young. So let's go to my presentation. Everybody know that we have to change health behavior to prevent chronic disease. It's a truism. A lot of research. We need to change health behavior for sure. So many papers underline that it's not only one behavior, but a lot of behavior: exercise, nutrition, alcohol, smoking behaviors, and you can have hope of survival if you combine these kind of behaviors. And of course, it's for chronic disease patients also. We have so many papers that show that if you do exercise, you will be in better health, but also just survival. And right now, you have so many papers explaining that because of the chronic disease, the costs, direct or indirect costs, and also for the family are absolutely huge. So we have to fight against this conclusion, and it's obvious. Well, the paradigm have to change from biomedical model to biosocial and psychosocial model. It's obvious, of course, with an integrated model of care and many reports, plans, strategies, program, policies. You can have in your country some laws, some decision from the politician. We need to change, etc., etc. And this morning, you can see, for example, for the European Association of Public Health, etc., etc., World Health Organization, we have so many things to do. Yes, but it's just an indication, an objective and goal. But what is the reality? The reality is this kind of campaign. You can see in the website of National Institute of Health. So we have to, you must do for your health. It's maybe interesting, but you have some recommendation, for example, in Europe about exercise. You have to do, you must. You have some brilliant architects, researcher that think that nudge strategy could be fantastic to change all the behaviors of humans. For example, here you can put a piano and you can go upstairs on how do you say? Okay, and it's you play music. It's fantastic to improve your health, especially for exercise. You can have so many digital tools. I recommend you to read this strategy with all the new way will be the digital tools to change health behaviors. Right. Only in Lyon, it's a railway station in Lyon, France, and it's just a picture for human, Homo sapiens sapiens, me and you. Here, you have to choose first escalator, mechanic, or here, okay, upstairs, or here, go to the railway station. Everybody choose what? This one. Yes? We know that we have to change behavior, but in the reality, it's not possible. Probably it's only Lyon. Let's go to Paris. Let's go to Paris. We work for 3 years in collective expertise in the Health National Research Center, INSERM, in France. And every year, I took a photo in here, small stairs. Okay, this year, in Paris. So Parisian people are the same than Lyon, etc., etc. Maybe Koseche, I don't know. But it's absolutely terrific. Between, I know that it could be interesting to change behavior, and the reality it's radically different. And for the nudge, a fantastic research. I like the presentation of Robert because it's a randomized controlled trial to verify the efficacy and the effectiveness of the strategy. They organize this kind of study, or you put just some foot step, okay, and we have to, and they compare if the person take stairs or elevator, and of course it's changed nothing. So nudge is not a real good reality. Let's go to digital tools. In China, they create a fantastic tool. Let's go. Do you see? Interesting. So, oh, excellent digital tools just to measure the number of steps. It's terrific. In our study, with a chronic disease patient, the person, maybe only French, or no, probably, but put the accelerometer in his dog. Not to him, just in the dog. It's really the difficulty, because it could be magic. It could be magic, but also it's really difficult because they don't change really all the people, especially person with chronic disease. And you can read a lot of synthesis, Cochrane, systematic review that can show that digital tools is not magic. It's not a radical change. It's the same for electronic cigarettes. To change behavior, to stop smoking, this Cochrane is absolutely remarkable without any change of behavioral cessation with this kind of electronic cigarettes. So maybe we need to be more modest and just to focus our strategy depending of our courses, our cooperation, our discipline. Of course, we have so many biological treatment here, but we have also to propose to the chronic disease patients some non-pharmacological intervention, psychological, physical, nutritional, digital, and also other intervention. And we have also cultural strategy and environmental strategy. It's another strategy, but we have to be more focused of how we can change behavior with some strategy with a theoretical base and also efficient base. That's why here the National Institute of Health created 20 years ago this institute for complementary health intervention. That's why French ministry created this report a few years ago to prescribe some non-pharmacological interventions. That's why the big chief of the French health organization, the professor Le Guludec, said we can have some exercise program can be better for the patient, not only to move, not only to change lifestyle and move, no, some specific and those specific intervention. That's why we need to improve the research here with the science to focus some NPIs, to personalize some NPIs with responders and not responder. We have to improve the content, the dose. Robert talked about the dose. The dose will be very, very important. Also the administration, the cost. And also we have to explain the context and the mechanism. And last but not least, to combine the non-pharmacological intervention, probably in a step care model as Scotland you can show Donna this stepped care solution. Probably in the beginning of the chronic disease, you can use only one NPI, but maybe with gravity, with the comorbidity, you can use several efficient non-pharmacological. That's why science needs to disseminate, separate the efficient evidence-based solution, NPIs, and of course to show that here it's just a consumer product. Art is just art. It's not heart therapy. It's the same for parallel medicine and so many things very, very dangerous right now. I will talk about that. And also dangerous practice for human. That's why in our discipline, we have to be more with more description of the intervention for the NPIs. As you can see in these papers published by Glasio and collaborator, it's absolutely unbelievable that the papers are not enough described for non-pharmacological intervention. So they phone and they email to the author to be more clear after the publication in this British Medical Journal. And as you can see, we are not enough described for each interventions. That's why we have confusion. When you read a paper in psychology or in exercise or in nutrition, they only, for some papers, focus on the category, on the discipline, psychology. Some just focus on psychotherapy or exercise in general. But the NPI is a specific level. It's a method. It's a method, for example, mindfulness-based stress reduction from Kabat-Zinn. It's an NPI because you have a theory, you have a techniques, you have a number of sessions, and it's really clear. You can compare scientifically this one and maybe another one, CBT, for example. It's not only techniques. Techniques or skills could be breathing technique, but it's not a real NPI. For example, you can see meditation. What is meditation? Meditation is everything and nothing in the same time. And last, material, a tool. For example, pedometer is not an NPI. It's just a tool for NPI. That's why we publish a lot in the platform about it's now the time to describe very precisely all the NPI. What is a name? What is a health goal? Prevent, cure, or care a health problem. With a target population, what age? Maybe gender, etc., etc. What kind of content, implementation content, also the program, skill, etc., etc. You need to describe also the mechanism of action. You can describe the professional. A nurse is not a psychologist. No. What is the position and the position for the patient? And you have so many confusion in the papers. Oh, it's just a educator in sport. What is an educator of sports? What kind of position and what is the relation with the patient? And also, because we need to have a real efficiency of NPI, we need an international intervention study. So one positive intervention study. I will come back for that. So with the platform SEPS of Montpellier, with several collaboration in Canada and in several parts of Europe, we define this category and subcategory of non-pharmacological intervention, but it's just categories. As you know, psychological intervention with art therapy, with health education, with psychotherapy, with probably also zootherapy, animals, equitherapy, for example, physical health intervention, physical activity, hortitherapy, physiotherapy, manual therapy, thermalism. It's the same for nutrition. What about the dietary supplements for nutritional therapy, diet. You have so many regime diet in English. You have so many digital tools also. More than 30,000 app, said Robert. So we have so many propositions, but what are the real efficient solutions? And of course, other health non-pharmacological intervention, ergonomic tools, physiotherapy, phytotherapy, the plant, cosmetic therapy, wave therapy, and also lithotherapy. So with a big grant in France and also a part in Europe, we built this search engine. It's free. It's dedicated to researchers. A lot of students here in our university are recommended to visit PubMed to find top-level clinical study. And in our domain, non-pharmacological intervention, PubMed is terrific. And maybe your professor say, oh, you need to maybe visit PsycInfo or PsychoInfo, but it's terrific because you lose a lot of papers, especially the papers published in some journal. You can ask and we can discuss about this aspect. So we create a meta search engine to combine all the database to identify the excellent, the rigorous trials for non-pharmacological intervention. And it is dedicated to, of course, improve the quality, the real quality of meta-analysis. Some of my PhD students published meta-analysis, and the big problem of the meta-analysis is that the data collection is not enough. We lose a lot of papers. So it's open for you, montreal.fr. The next solution is here, the International Registry of Researchers and Institutions assessing a non-pharmacological intervention. It's also free for everywhere in the world. If you are a researcher and if you publish a paper in intervention study, you can register because it's absolutely terrible. My colleague at the hospital or my colleague at the university is not the specialist or maybe psychotherapy or maybe nutrition research, but we have so many famous researchers maybe in another country, and we have to have very impressive connection with experts, and the expert will be maybe in 10,000 kilometers, but please, it's free for you also. And next month, we will build and open this website called Nicher. It's for the PhD report or master degree report or unpublished research report assessing non-pharmacological intervention for any language. It's absolutely unbelievable that a lot of PhD is just not published, only a publication, but no PhD. And so we want to create an international open source library to collect and to share with so many languages the connection with that. So please also, it will be open next month. So the platform steps, it's an academic platform, meta search engine for Montreal, NERI, Nicher, and also international conference since 2011. So as you can see, we invite a lot of famous researchers in behavioral medicine, in non-pharmacological intervention from China, from everywhere. And of course, at least but not least, your Iveta, absolutely wonderful. And we need to collaborate not only in our country, but to improve the quality of the intervention trial. It's absolutely terrific to read so many papers with a bias from outcome, bias for design, bias for analysis, and we need to improve the quality of the design. Robert, it's a perfect example. If I need to evaluate the efficacy or the effectiveness of a strategy, it's not only some satisfaction or only one question of quality of life. It's more than that. We have to improve the quality of the study to be really efficient to the patient. And so in the platform, we also work in the classification of the non-pharmacological intervention, and we propose some recommendation for the scientific evaluation of a non-pharmacological intervention. So I hope that I can demonstrate that it's not only useful to recommend lifestyle change, lifestyle incentive. We need to prescribe, to follow personalized and evidence-based solution for prevention and care. It's really a priority in our countries, especially in our countries because you have internet. And because internet, in our last papers in cancer and breast cancer association, it's absolutely terrific that the person contact another patient to use some plants, some curcuma, I don't know in English, the product curcuma, yeah, and it's terrific. The person can download and buy some product from China, from everywhere, and say, oh, it's very, very, very efficient. I don't want to have some information with the oncologist or with the doctor, and I can do everything and sell everything. So maybe patient could be less naive, but I think paradoxically they are more vulnerable because of the abuse of not science, not science, but the dangerous practice, and also the misinformation. It's absolutely unbelievable that the marketing is more powerful than science to recommend to some patient some suggestion. So thank you very much, and sorry for my English, I do the best.